Welcome to the Rare Wellness Podcast. Wellness is a rare treasure hidden in a maze of daily challenges. In this podcast, we eliminate uncommon pathways to health and vitality, exploring cutting-edge ideas in regenerative, longevity, and performance medicine, all delivered in bite-sized segments of 5 minutes or less. I'm your host, Dr. Jamie Lewis, and today we're diving into platelet-rich plasma with my colleague, Dr. Howard Gratton. This podcast is brought to you by the Northwest Center for Regenerative Performance Medicine, located in the beautiful Pacific Northwest. Visit us online at www.nwc4rm.com. Before we begin, a quick disclaimer. This podcast is for educational purposes only and not intended for medical advice. Always consult a qualified healthcare professional for any medical concerns or treatment. Today, we're joined by Dr. Howard Gratton to explore a field that is revolutionizing medicine. So, Dr. Gratton, let's start with the basics. What exactly is platelet-rich plasma?
Platelet-rich plasma, or PRP, is a regenerative therapy that utilizes the patient's own platelets to promote healing. We start with a simple blood draw and then use a centrifuge to separate the platelets from the other components, such as red and white blood cells. The resulting plasma is rich in platelets, and the platelets contain the growth factors and proteins that play a key role in tissue repair and regeneration.
That's an important point because not all PRP is created equal. To be considered platelet-rich plasma, the concentration of the platelets must be at least 2 times the baseline found in normal blood. And this was standardized by a study that was published by Robert Marks in 2004. In the Journal of Oral and Maxillary Facial Surgery.
Exactly. Yeah, and more recent research has emphasized the importance of platelet concentration and total platelet dose in determining the likelihood of a good therapeutic outcome. And it's not just about drawing blood and spinning it. It's about achieving the right concentration to maximize healing potential.
Right. And now that we've kind of defined what PRP is, let's talk a little bit about how it actually works. Dr. Gratton, can you break that down for us a little more?
Sure. PRP works by leveraging the body's natural healing mechanisms. When injected into an injured area, platelet-rich plasma helps in 3 different ways. It reduces inflammation. The platelets kind of release bioactive molecules that calm inflammation and modulate the immune response. And then it stimulates repair. There's several growth factors like platelet-derived growth factor being the big one, and also vascular endothelial-derived growth factor, which stimulates production of new cells and blood vessels to accelerate the tissue repair. And then it recruits healing cells. Platelet-rich plasma signals the healing cells, including stem cells, to migrate to the injured area, enhancing the body's regenerative response.
I think that's why PRP is such an exciting tool in regenerative medicine, because it's tapping into your body's own healing capabilities rather than relying on pharmaceuticals or invasive procedures. Let's dive into real-world applications of platelet-rich plasma, particularly in orthopedic conditions. Dr. Gratton, what are some of the most common uses of platelet-rich plasma in musculoskeletal medicine that you're seeing?
PRP has been widely studied and used in treating osteoarthritis, tendon injury, ligament, muscle injury. And so, like with osteoarthritis, it helps to reduce the pain and improve function and even promote cartilage repair by decreasing the inflammation in the joint. In tendon injuries, conditions like tennis elbow, Achilles tendonitis, these have been shown to have faster recovery times and reduced pain when treated with PRP. And then athletes with ligament and muscle injuries frequently use PRP for ligament sprains, muscle tears, to expedite recovery and get back into training sooner.
And to support that, there's a fantastic review compiled by Dr. Chris Centeno in July of 2024. We'll pull that slide up. But you and I had the privilege of meeting Dr. Centeno recently in one of the conferences. He did a really good job at showing the evidence behind using PRP for orthopedic conditions.
That infographic is a great resource, and really it visually maps out the studies using different color-coded circles. The blue circles represent studies that found PRP to be effective, and the dark green circles indicate where PRP was superior to standard of care or to placebo. And the light green circles show where PRP was effective, but not compared against standard of care. And then the uncolored circles meant PRP was equivalent to a comparator, but still effective. The red circles indicate when the PRP was inferior to another biologic or treatment, like hyaluronic acid or corticosteroids. And you can see there's not many red circles. An exclamation symbol flags the studies that failed to meet Dr. Mark's 2 times platelet concentration threshold for PRP. And nowadays, with our treatment paradigms, 2 times concentration is extremely low dose. Yeah, so they didn't even meet that 2 times concentration threshold. Now we're using 14, 20 times concentration.
Right. So the key takeaways is that PRP has been effectively used for many musculoskeletal conditions, however, showing equal or superior efficacy compared to standard interventions like steroid injections, which make this viable and holistic alternative to more traditional care. With all the evidence supporting PRP, it's clearly making a mark in orthopedic medicine. What do you see the field heading to, Dr. Cran?
Well, regenerative medicine has a bright future. There's still room for refinement, ensuring proper platelet concentration and dosing and best practice protocols is crucial for maximizing patient outcomes. More research is being done in optimizing the dosing protocol to make PRP even more effective.
That's something we really emphasize here at the Center for Regenerative and Performance Medicine. By following the best practices, we ensure that patients receive the highest quality PRP treatments tailored to their specific needs.
Absolutely. As research continues to evolve, I expect we'll see PRP being used for a wider range of conditions with improved dosing strategies and possibly even standardized formulations.
This is a shining example of how regenerative medicine can harness your body's own healing potential to treat injuries and chronic conditions. It's natural and effective alternative to traditional treatments.
And as we continue to refine our techniques and protocols, we'll only improve patient outcomes and expand PRP's applications.
If you're interested in learning more about PRP or other regenerative treatments, visit us at www.nwc4rm.com. And thank you for joining us today on the Rare Wellness Podcast. If you found value in today's episode or learned something new, please subscribe, leave a review, and share this podcast with a friend. Your support helps us to continue to provide free content to empower you on your journey to better health. This is Dr. Jamie Lewis reminding you, your body holds incredible potential to heal, thrive, and perform. Sometimes you just need the right tools to help you live your best life now. We'll see you next time.